Hi guys, good morning. I just wanted to quickly go over this cancer lecture with you. As you guys know, I was an hematology oncology nurse. But cancer nurses have to have a special certification to give chemotherapy, even the oral medications. So as an LPN or even an RN without that certification, you cannot give any chemo agents, even if it's just a pill. But I still do want to go over kind of the basic side effects that you get from these kind of medications because you'll be dealing with that. But we're not going to dive too heavily into the actual medications on this lecture. So cancer it uses anti-neoplastic. So a neoplasm is like a tumor or a cancer. So these are anti-cancer. Cancer is a disorder of cellular growth. So I'll let you read through this slide on your own time, but basically it is cells that have lost the ability to check themselves and limit their own growth. And that starts to take over the body and crowd out healthy cells. And when it starts going to other places in the body from the original spot, that's called metastasis or METs. So we combat this with surgery, radiation, chemo, and immunotherapy. A lot of times cancer works at a very specific part in the cell cycle. So you guys remember mitosis and cell division. There are parts in the cycle where the cancer cell is more vulnerable to the chemo. And so that's what most of these drugs are targeting specific areas of the cell cycle, and other chemos are not cell cycle specific. So the goals are basically to give enough chemo or anti-neoplastic agents, whether it's radiation, chemo, immunotherapy, that it takes care of the cancer, but it's not too toxic to the body. Chemo is essentially poison. I always said when I was a nurse, someday we're going to have enough advancement that I'm going to say, back in my day, we used to give chemo, and the younger nurses around me would be like, oh my gosh, that's so barbaric. You are poisoning your patient. Because the thing with chemo is it is poisonous and it is not a targeted therapy in most cases, and that it cannot differentiate between the cancer cells and the healthy cells. So cancer cells are rapidly dividing cells, and so that's what the chemo sees. It sees any rapidly dividing cell and it attacks it. Well, the problem is we have rapidly dividing cells that are healthy and not cancer. So like the cells in our mucous membranes are rapidly dividing, which is why chemo patients get really bad mouth sores. Our hair are rapidly dividing cells, which is why chemo patients lose their hair. And chemo causes a lot of toxicity in the body. So it can, sometimes people that have really serious complications or pass away from their cancer, sometimes it's more due to the treatment than the cancer itself. So a lot of the nursing around that is maintaining these side effects and trying to keep the patient as healthy and comfortable as possible while we fight this cancer. This is a very research-based field in medicine. When patients are receiving chemotherapy, they are on some kind of a trial for the most part. So we really are seeing a lot of advancements, and the goal is really to have just targeted therapy. So to get our therapy so that it's only targeting the cancer cells and not the healthy cells. So for nursing interventions, just like everything else, we want to look at labs, monitor for the development of emergencies. We'll talk more about what that looks like, report any early signs of infection, help manage that nausea and vomiting, any mouth sores or pain associated with the treatment. So one thing that cancer affects is the bone marrow. That cancer too, but the chemo affects is the bone marrow. So we'll see that they will have low white blood cells, low platelets, low red blood cells. So we're really watching those labs, and because they have low platelets, they're at risk for bleeding. Because they have low red blood cells, they're anemic, and their body is starved for oxygen, and they might need blood. And because they have low white blood cells, they are really high risk for infection. And actually, a fever in these patients is a medical emergency. They can die very quickly because they just don't have that immune system. So we are trying to keep them hydrated, comfortable, pain-free as possible, managing their pain, their nausea and vomiting, and really assessing very carefully their labs and head-to-toe assessment. We want to watch for changes in bowel movements. Again, so mucous membranes from the mouth to anus is all a mucous membrane. So they can get mouth sores and GI disturbances all through there. So we want to help with the pain associated maybe with bowel movements or that GI tract. If they're having diarrhea, we want to make sure they don't have C. diff because, again, they're more susceptible to infection. We want to make sure that through nausea, vomiting, and diarrhea, they're not getting dehydrated, they're not losing too many electrolytes. So that stomatitis is those mouth sores that we talked to. So we really got to keep their mouth clean, and that is done to prevent infection and to help with the pain. Report immediately any signs of bleeding. We really want to be aggressive with pain meds in cancer patients. They often aren't able to eat very well, so we're making sure that we are looking at ways we can support them nutritionally. We want to discuss sexual needs with our patients, if that's appropriate. Birth control during chemotherapy and the option to freeze or store sperm or eggs, because cancer therapy does affect reproductive health. So if they want to preserve those for later, we want to make sure they have that option. They will get some kind of a vascular access device, so like a central line or a port, which is a central line. And then we want to really carefully watch for skin breakdown. So we want to teach patients about neutropenia. Neutropenia is when those neutrophils, which is a type of white blood cell, get really low. And so we call them neutropenic patients, or they're on neutropenic precautions. So we want to make sure that they're doing really good hand washing, avoiding sick people. We don't want to have any fresh flowers in their house or in their hospital room because that can carry in fungus and bacteria. Any vegetables or fruit that are kind of porous or have like dents in them, we want to make sure that they avoid those and that they're washing everything really well to kind of avoid bacteria. Stuff that might normally be in our food that we would be fine with because of their lack of immune system could make them really sick. They want to avoid anything that's like a buffet or something with food sitting out, or like a picnic with a bunch of dishes. And they can't always get their immunizations because to get an immunization, you have to have an immune system to respond to it, and often their immune system is so suppressed that they can't. They also want to avoid anyone that has had a live vaccine because that could also infect them. Again, we're very aggressive with pain control. With anemia, we're giving them blood transfusions if needed and really trying to cluster care and promote rest. And then thrombocytopenia, so neutropenia, thrombocytopenia, important terms to know. This is low platelets. We want to monitor for bleeding. And they're going to be on thrombocytopenic precautions. So they can't be on ibuprofen or aspirin or any kind of an anticoagulant. We want to avoid any contact sports. They want to use an electric razor, not a straight razor. A soft bristle toothbrush. Gums can bleed very easily. And just teach them how to monitor and where to look for signs of bleeding. So again, we're giving them a lot of emotional support to both them and their family. It takes a very multidisciplinary team to help these patients, help them and assess their body image and self-esteem. Their body goes through a lot of changes on these medications, being very aggressive with pain management, watching for nutritional deficits, and making sure they stay hydrated, doing whatever we can to decrease fatigue, minimizing that risk for infection, and then really trying to keep those mucous membranes intact and clean and help minimize the pain that they cause. Those sores tend to heal up as the patient's counts go up, so as their white cell count comes up and platelets and everything else. So a patient has developed thrombocytopenia following chemo. The nurse should instruct the patient to, that would be A, use an electric razor because thrombocytopenia means low platelets. Wash hands frequently would be for low white blood cell count. Planning activities to allow rest would be for a low red cell count. That'd be anemia. And report temperature evaluations, again, would be for the decrease in white blood cell count, which is your immunity. So I'm not going to dive into this, but one kind of chemo is called an alkylating agent. It causes nausea, vomiting, and then it can also have reproductive health risks. Alopecia is the fancy name for hair loss. Some patients have this without getting chemo. It's just something that people can have, kind of a benign condition in and of itself. But again, patients lose hair because chemo attacks rapidly dividing cells. They can get cysts that are hemorrhagic or bleed. That causes birth defects. And then it causes that thrombocytopenia, so decrease in platelets, and leukopenia, so decrease in white blood cells, leukocytes. So nurses that give this chemo, that won't be used. Some of these chemos are called vesicants. So if they leak out of the IV site, it will burn and eat away at the patient's skin. They can actually lose a limb. So that's why they need a central line, something that goes into a large vessel. So if there's any leaking, it's not as severe as if it's it's less likely to leak if it's in a central line in a larger vessel. We always want to make sure labs are within normal limits, report any adverse effects. Lots of pre-medications, so giving them the antiemetics before they get sick. Giving them lots of hydration, watching those I's and O's closely. Chemo is actually in your bodily fluids, and so for 48 hours after chemo, urine, stuff like that, blood is considered to be basically chemo. So we need to make sure that they are urinating frequently to flush that out of their body, but also as healthcare providers, we need to make sure that we're wearing protective equipment when we're dealing with these bodily fluids. It usually involves wearing 2 pairs of chemo gloves and double flushing the toilet. Okay.